The relationship that I have with my patient, that I assume most patients have with their oncologist, has to be a very open one. As the oncologist, we're playing a very important role in helping a patient and dealing with that sort of an illness. For most of them, they've never experienced anything like that and don't know a lot of people who have experienced things like that, and yet we're dealing with dozens of patients a week who are going through very similar things and so have a lot of experience with that. It's important that it's a partnership. I never want to be in a role where I'm telling a patient you have to do this, or this. I always want to be open to hear how the patient's looking at it too. I look at it as my advice is to let the patients know what the options are to help guide them, but to know that they're going to be looking at those different options in a way that I can't, because I can't be them. I'm not coming from their life experiences or from their life goals, but to help guide them. It's really critical that people feel comfortable letting their oncologist know if they're exploring alternative therapies, because some of those can interact with the chemotherapies, but many of them don't. And we're much happier knowing than finding out later if there's something else going on. Most oncologists are very open to hearing about other healing practices that people are looking into. We're not trained in all of that in the same way, and I try to be very open-minded and encourage my patients to talk with me about it. And also it's very important if someone's having particular fears to let their oncologist know, or if they know someone who had a bad experience with chemo that's really clouding how they're looking at it, to be able to talk through that so they can weigh that in its appropriate context, as opposed to having that one experience be their whole thought about what it is to be with chemotherapy, as opposed to knowing what it's like for hundreds of patients, and that they're outliers, but it's not the same for everybody. So it's a partnership, it's a friendship in a way. It has to be.